Mr. President, I have always believed that elected officials should do more listening than talking. The breadth of issues that we address here in the United States Senate is vast and diverse as our nation. We rely on input from experts, from stakeholders, and constituents to craft responsible, meaningful policy. In the past month alone, I've had the opportunity to attend bipartisan hearings on cybersecurity, countering violent extremism, self-driving cars, rural broadband, nuclear defense policy, and the posture of our armed forces, just to name a few. These issues are vital to our economy and our national security, and they are worthy of the time and effort that went into convening these very important hearings. But over the same time span, the United States Senate did not hold a single hearing on health care while a handful of Republican members drafted a flawed health care bill behind closed doors. Health care policy is unique. It is very complex while also being deeply personal. Throughout our lives, doctors and nurses are with us for some of our most significant moments. Whether it is responding to trauma in an emergency, helping us live with chronic conditions, devising treatment plans for an ailing parent, or delivering a newborn child. Our medical professionals are there for us when we are at our most vulnerable. And we are all vulnerable. Life does not discriminate. Anyone can get in a car accident and need months of physical therapy. Anyone can be diagnosed with cancer and require surgery and radiation or chemotherapy. Anyone can have a son or daughter born with cystic fibrosis. But in this great country, I believe no one should ever go bankrupt because they get sick. And no one should ever die because they cannot afford quality health insurance. No matter, I believe that healthcare policy is very complex, and we have to work very hard at it, but I'm also guided by a very simple moral concept, that no matter who you are and no matter where you live in this country, no citizen should ever be forced into bankruptcy because they are sick, and no one should ever die because they can't afford quality insurance. And I urge my colleagues to use the coming days to think about their goals for health care in our nation and be guided by their own moral conscience. Passing a politically expedient proposal that can get 51 Republican votes after significant arm twisting so that the Senate can move on to tax reform is not in the best interest of the American people, and I believe it is simply irresponsible. I believe that we should provide the best care possible to as many Americans as possible while making sure that it is affordable. Now, I honestly can't say whether my Republican colleagues share these goals, but I can say that the Senate health care bill that we saw this week does not hit the mark. I urge my colleagues to use the coming days to really think about what this bill will mean for the families in their state. I feel fortunate that Michiganders have been willing to share their heartfelt stories with me in recent years. They are fearful that repealing the Affordable Care Act will not only put themselves in jeopardy, but also their friends and family and neighbors. I've heard from Amy from Metro Detroit. She's 53 years old and has type 1 diabetes, also known as juvenile diabetes. Amy is a self-employed small business owner, and before the Affordable Care Act, insurance companies viewed her diabetes diagnosis as a pre-existing condition and were able to charge her more because of it. After the Affordable Care Act was implemented, Amy was able to shop around and find a much more affordable plan with the same level of benefits that she had before. While Amy does not qualify for subsidies to help purchase insurance, she was still able to cut her health care cost in half because of the Affordable Care Act. Amy fears, and rightfully so, that if the Republican health care bill passes, her costs may skyrocket. jeopardizing her business and everything that she has worked her entire life for. I've heard from Tammy, who lives in Marne, Michigan, and Tammy's daughter, Erin, is 10 years old. Erin was diagnosed with cystic fibrosis at 18 months. She takes 23 pills and does 2 hours of breathing treatments each and every day. But she's a fighter, and her whole family has pulled together to support her, but they are also very worried about her future. Erin's family has private insurance, but they supplement the high cost of her care through Medicaid. Tammy is afraid that the $800 billion cut to Medicaid will jeopardize their ability to afford Erin's care and would cast an absolutely devastating blow to their family. And finally, take Stephanie from Livonia, Michigan. Stephanie worked her entire adult life in customer service industry, primarily in retail and at restaurants. She never was ever offered health insurance by her previous employers, and until the Affordable Care Act, she never had health insurance as an adult. And then in December of 2015, Stephanie's third-floor apartment caught fire, and she was left to make a horrific decision about whether to jump from her third-floor apartment or die inside the burning building. Well, Stephanie jumped from the window to save her life, and she sustained serious injuries, including a broken back and a shattered foot. Because of the Affordable Care Act, she was able to receive treatment for her injuries, which included a month's stay in the hospital, multiple surgeries, and absolutely excruciating physical therapy to finally heal in the end. Stephanie's treatment came in close to $700,000, an amount that would surely bankrupt nearly any American. These stories and many more are what health insurance is truly about for people like Stephanie and Amy and Erin. We should do more listening than talking. We should listen to Stephanie and Amy and Erin, and we should listen to the hundreds of healthcare experts that have expressed their strong opposition to this bill and the impact that it'll have on the healthcare system in this country. Mr. President, I would urge my colleagues to listen to the AARP, the American Academy of Pediatrics, the American Diabetes Association, the American Hospital Association, the American Heart Association, the American Medical Association, the Children's Hospital Association, the National Alliance on Mental Illness, the National Breast Cancer Coalition, and the National Council on Aging, just to name a few. And I'm not just hearing from these national groups. I'm also hearing from local healthcare professionals all across my state. Hospitals and community clinics in Michigan, particularly the ones in the rural areas, are telling me this bill could cause them to close their doors. This will jeopardize access to care in communities that are already medically underserved. Costs will go up for seniors and individuals with pre-existing conditions like Amy. No one chooses to get sick, but when we are confronting a disease or injury, health insurance is a lifeline. It allows us to get better, to get back on our feet, and it simply allows us to keep living. In American society, healthcare coverage is our promise that if you work hard and you play by the rules, you will have the healthcare you need when you need it the most. As I've already said, no one in this great country should be forced into bankruptcy because they are sick. And no one should ever die because they can't afford quality insurance. The Republican health care bill is irresponsible. This bill would strip away health insurance from 22 million Americans. This bill would put more and more Americans at risk of financial ruin from unpaid medical bills. And it would put more Americans at risk of dying because they can't afford the care that they so desperately need. Mr. President, this bill cannot and should not be salvaged with minor tweaks and arm twisting to win a few votes. I urge my colleagues to go back to the drawing board and begin an open, bipartisan process where we all listen to our constituents, hold hearings with experts, and work together to keep what works and to fix what doesn't. Let's let common sense rule the day and not partisan ideology. We should do what is best for our folks back home and ensure that everyone has access to quality, affordable health care. Michiganders and all Americans deserve nothing less.